My name is Francis Gonzalez, and I'm an orthopedic surgeon at UC San Diego Health. I specialize in adult hip and knee replacements. The type of patients that I see in clinic are folks that are suffering from arthritis, causing them pain, limitations, and overall decreased quality of life. Over the last decade here at UC San Diego Health, my clinical interests include performing the desired muscle-sparing anterior total hip replacement. This allows my patients to return back to an active lifestyle at an accelerated fashion. More recently, I performed total knee replacements using robotic technology. This is a personalized approach to total knee replacements that allows me to be as precise and accurate as I possibly can be, with the goal of getting the most functional, well-balanced knee that feels natural. My approach to patient care is plain and simple. I look at every one of my patients as if they're my family. By doing so, I'm able to understand the patient better and really listen to their condition and really develop a personalized plan for that patient. Coming to a physician, especially when they're considering surgery, is quite scary, is filled with anxiety, and really we want to decrease that as much as possible. So what I try to do at that first meeting is really just listen to the patient. I want to make sure they understand that I'm with them from the beginning all the way to the end. And with joint replacements, it's really a relationship that lasts their lifetime, because I want to make sure that they're doing well 10, 15, 20 years down the road, making sure that joint replacement is doing well and they're still living their active life.